So there's four major valves in the heart: the mitral valve, the tricuspid valve, the aortic valve, and the pulmonary valve. There can be abnormalities of every heart valve, which is why every murmur evaluation we look at each valve closely and determine not only if it developed normally, but how it works. Pediatric patients are certainly a unique patient population. The most common valve problem that we see that babies are born with, which would be a bicuspid aortic valve. It's where the aortic valve is typically formed and it has 3 leaflets. But instead of having 3, these babies, children, whenever they're diagnosed, they were born with it, but sometimes they're diagnosed later in life because they don't develop a murmur right away. It only has 2 leaflets. So those murmurs, or those bicuspid aortic valves that are formed abnormally, are more likely to develop narrowing. We call that stenosis, or leakage. We call that insufficiency. And then other things that go along with that is the aorta that's right next to it is more likely to become enlarged. And a baby with a bad heart problem, they're going to exhibit signs of heart failure, which would be breathing fast, not gaining weight. But older children, young adults, can tell us that they're having symptoms, which would be chest pain and the such. And babies can exhibit chest pain as irritability, so we also pay attention to a very irritable baby. If they have a murmur that is indicative of a heart problem, pay really close attention to that, and maybe the valve would be causing problems. So that's how we would look at signs or symptoms of babies or young adults with valve problems. So how we would treat stenosis, narrowing of the aortic valve or pulmonary valve, would be what we call balloon valvuloplasty, which is you just tear the valve open using a balloon interventionally without heart surgery.